Union Minister of Health and Family Welfare, Mansukh Mandaviya, on Tuesday confirmed the Nipah virus outbreak in the Kozhikode district after the results of samples from the National Institute of Virology in Pune were released. What is the Nipah virus and why should one take all possible precautions to avoid contracting it? Here's a fact check. The virus was first identified in the Kampung Sungai Nipah area of Malaysia in 1998 when a brain fever epidemic broke. The NIV infection was reported later in Bangladesh in 2001 after it spread to humans who consumed date palm sap contaminated by infected fruit bats. According to World Health Organization, human-to-human transmission has also been documented in India. The first case of Nipah virus happened when people who were in contact with infected pigs began getting very sick. Researchers then determined bats were the original source, having passed the virus to pigs. Transmission of Nipah virus to humans occurs after direct contact with infected bats, infected pigs, or other Nipah virus infected people. The disease spreads from fruit bats to humans as well as animals. People working at pig breeding centers are also vulnerable to the virus. The virus can also pass on to humans from fruits that have been touched by bats. Initial symptoms of Nipah virus may include symptoms typically begin within 4 to 14 days after exposure to the virus. It is common to have a fever or headache first and develop respiratory problems like cough and difficulty breathing later. In severe cases, a person can develop brain infections, which is life-threatening. Other severe symptoms include According to the World Health Organization, Nipah virus infection in humans has a range of clinical presentations from asymptomatic infection to acute respiratory syndrome and fatal encephalitis. No vaccine has been developed yet. The best way to avoid Nipah virus is to avoid exposure to sick animals, especially bats and pigs, in areas with known transmission. This includes avoiding food products that an infected animal can contaminate, like a raw date palm sap or fruit. There are no antiviral medications to treat the virus. This means treatment consists of managing one's symptoms. This may consist of drinking lots of water, getting plenty of rest, using medications to control nausea or vomiting, using inhalers or nebulizers to improve breathing difficulties, taking anti-seizure medications if one experiences a seizure.